So in a nutshell, Peter, what do you think the future holds?
Look, in summary, I think it's likely that companies working with bacteriophage will be big companies if they can overcome the hurdles discussed above. There was a 2014 Wellcome UK report that suggested that antibiotic resistance could lead to 10 million people dying each year by 2050. So that's a significant pressure to develop solutions to this problem. And it would really provide impetus for governments to invest in technologies that can address it. The two most interesting companies in this space are C3J Therapeutics and Amplify. And interestingly enough, they've both come to the realization that there's value in combining forces. So recently they've announced that they have merged to form a new company called Amata Pharmaceuticals, Inc. This makes a lot of sense because they can combine the IP from Amplify that we've talked about and from C3J and develop a very diversified approach to the problem of multi-drug resistant bacteria using phage technology.
How do you see the advances in CRISPR going ahead?
Well, I think that gene therapy in general is likely to be a difficult field to grow broadly. It may always be a niche area. One of the problems with CRISPR at the moment, as with most gene therapy, is that once the technology has been in there and worked and cut the DNA, that's it. You can't reverse it. So if something goes wrong downstream as a result of that gene change, then that could cause serious adverse effects, and there have been concerns around cancer and other effects of CRISPR that have been discussed. So whilst companies working in gene therapy have worked for many years to try to solve the delivery challenges, and largely those challenges are still there, but there are some nice solutions that CRISPR can use. The companies that are now using CRISPR in the clinic are paving the way and will demonstrate, hopefully, whether there are or are not long-term safety effects. And Intellia, who are developing a range of interesting applications for CRISPR technology, may benefit from being behind that first clinical wave, so that they can see the effects of the CRISPR gene editing process in humans and modify, if needed, their approach to deliver a safer, more effective product. So I think those two companies in those two fields are my favourites at the moment.